Okay, so good afternoon, everyone. Today we're going to revise microbiology really fast by solving a couple of questions. Um, that's all. Let's start. Okay. Tamam. So let's read the question. So a 25-year-old man comes to the physician because of a 5-day history of crampy abdominal pain and diarrhea. During this time, he had 4 to 6 soft, voluminous, frothy bowel movements per day with fatigue, bloating, flatulence, and nausea. 9 days ago, he returned from a 2-week hiking trip to Colorado, during which he drank water from the mountain stream. Wait, okay. His temperature is 37 degrees and a stool specimen shows no leukocytes and a fecal occult blood test is negative. So let's highlight together what is important. What do you think is important?
I guess he drank water from a mountain stream,
Okay, that is important. Okay.
and fecal occult blood test is negative.
Okay, so what are you thinking because of that?
Gardias.
Okay, perfect. You are right. Come on, another important thing is basically the bowel movement, which is like watery. So we have watery diarrhea. Tamam? So you're absolutely right. It's giardiasis because of the hiking trip. He drank water from like a mountain stream while hiking. He has like voluminous frothy bowel movement that's watery, and there's no blood. The thing that we would think of is giardia, and you guys can see صراحة giardia is one of my favorite parasites or whatever it is. I don't know why, but it looks really funny and I've always liked it. Anyways, moving on. Yalla, a 29-year-old woman comes to the physician because of a high-grade fever, headache, and muscle pain. A week ago, she returned from India. Okay, keep that in mind. She took a single dose of chloroquine and her temperature is 39.3. So we have fever. Physical examination shows jaundice, so the liver is affected. Her hemoglobin concentration is 10, which is decreased. Um, okay. And what is it called? A peripheral blood smear is shown in here. طبعا the peripheral blood smear, guys, should like literally like directly tell you what the answer is. But in this question we have a twist and I want to see if you guys can figure out the twist. So what do you think it is?
I guess it's A عشان falciparum isn't really in India.
Actually, it's
ولا plot twist B.
yeah, plot twist, it's B. And I'll tell you why. Because she already took chloroquine, so we have to think of which plasmodium is resistant to chloroquine. For Plasmodium falciparum is the one that's like Plasmodium ovale is usually chloroquine sensitive, okay? فإنه if she took chloroquine, she's going to be protected from Plasmodium ovale. But because Plasmodium falciparum is resistant to chloroquine, her prophylactic treatment with chloroquine did not help. Okay. فيعني هيك teeny tiny details, look out for them, guys, because they can easily trick you with these things. تمام. Next, what was the infection? Wait, no. How was the infection in the above case acquired? So what is the, let's say, like the mode of like how did they get the disease?
I guess contaminated. ولا
So you think it's contaminated. You don't think like it's a
no,
vector.
mosquito.
So it's basically the Anopheles mosquito.
Yes.
So the patient probably, wait, oopsies. Okay, so the patient probably had like Anopheles mosquito biting it, okay, causing the malaria. طيب, why would the infectious disease why would the infectious disease resident caring for this patient give him permaquine? Do you guys know what permaquine is? So basically, you know how do we treat malaria? We treat it with basically chloroquine, but in this case, chloroquine is not only sufficient. Why?
Is it because A?
Yeah,
ولا-
you're right. Because we know that basically the parasite is going to like, okay, you see how in here it's inside the erythrocyte, okay, but when you remember the life cycle, it has a stage where it's not confined within the erythrocyte and it goes into the liver, right? So we want to make sure that it does not stay in the liver and it does not cause a relapse of the disease. So that's why we give primaquine, which can treat the like the parasite that is outside of the erythrocyte. All right? Yalla. You're doing amazing. Let's go on. Your patient is in the emergency room and he has a 5 centimeter ulcer on her leg. It's surrounded by red, warm, and tender area of inflammation. You do a gram stain on the pus from the ulcer and see gram-positive cocci. So we have gram-positive cocci, all right? And they're in chains. Culture of the pus grows small beta hemolytic colonies, okay? They're catalase negative and they're inhibited by bacitracin. So what do you think it is? So let's go step by step. First of all, their catalase is negative. So this means it's not staphylococcus, all right? And they are in their gram-positive cocci in chains. I don't think they're going to be enterococcus. So we have Streptococcus agalactia, pneumonia, and pyogenes. So Streptococcus agalactia, is it beta hemolytic?
Wait, can you repeat? Galactia, it is beta hemolytic.
It is beta hemolytic. Okay, so it might be a choice, but is it resistant or sensitive to bacitracin?
I think it's resistant.
Resistant, right. So it cannot be Streptococcus agalactia. طيب, can it be Streptococcus pneumonia? Is it beta hemolytic أصلا?
No, it's alpha hemolytic.
It's alpha hemolytic, so it's not. So that's how we can choose strep pyogenes. تمام? So just guys, like while reading the question, you can just, I'm just showing you how you can think through the question. تمام? Okay. Yalla, a 45-year-old man from a rural area in West Africa presented to the clinic. He reports having lived near a fast-flowing river. So he lives beside a river, okay? Let's keep this in mind. He has a rash, itching. He experienced progressive vision loss, which he described as seeing flashes of light and dark spots. Let's ignore how. He also mentioned frequent headaches and occasional swelling of his lower legs. Upon examination, the physician noted multiple palpable nodules under the skin. So what do you guys think this is? So we have visual problems, flashes of light, dark spots. We have nodules that are under the skin or multiple. So let's look at the choices. Aslan, those two, like A and C, are so weird that you guys did not even take them, right?
Yeah, we only just took that Wishereria Bancrofti is just like an elephantitis.
Oh, okay. Fanny, you didn't go, like, you didn't take it and like really
No.
deep. Yeah, for A and C are gone. Okay. طيب, B and D. Cutaneous leishmaniasis has nothing to do with the eyes, right? It's from the name. It's basically like cutaneous, so it's something that has to do with the skin. But it's not D. And when we're talking about eyesight, and when you think of onchocerca volvulus, what do you guys think of? Their very famous name. What is it? What is it? Like a manifestation in the eye.
A manifestation of the eye. What does it remind me of?
It's
River
and he
blindness.
lives beside the river.
River blindness.
Exactly. So that's why we chose B. تمام؟ طيب هلا for B اللي هو onchocerciasis. What is the diagnostic method? How can I know like, oh, like this patient has onchocerciasis?
Skin snip.
Okay, perfect. Because aslan in the blood, it's not going to show anything. Biopsy of the eye sounds horrendous, and a complete blood count is not going to show you the actual like parasite, right? طيب, how is Onchocerca volvulus primarily transmitted to humans?
Black flies.
Exactly. It's a vector-borne transmission via black flies. Perfect. Yalla, next. An outbreak of serious pneumococcal pneumonia and sepsis, okay, is an overcrowded prison has occurred. Tamam. Laboratory analysis determined that one serotype was involved. The prison physician said that the pneumococcal vaccine might have limited the outbreak. Okay. طيب, which one of the following structures of the pneumococcus is responsible for determining the serotype and is also the immugen of the vaccine? What do you think?
Capsule.
exactly. It is the capsule. طب why is it not the flagellar protein مثلا?
Uh, I guess because it's not a violence factor in
You're right. It's not a virulence factor, and أصلا like it the bacteria, this kind of bacteria اللي هي pneumococcal does not even have a flagella, so it's gone. O antigen is usually found where?
antigen. I think was it in a gram negative for
Exactly. You're
yeah.
right. So O antigen is usually found in gram negative. فلأنه it's this is a gram positive, like we're talking about strep pneumo, right? طيب peptidoglycan, okay, it does have a peptidoglycan, بس كمان peptidoglycan has nothing to do with virulence. Like all of the bacteria, most of them have virulence, and it doesn't have to do with, it can have to, يعني it can like affect immunogenicity and so on, but it's not the thing that causes the different serotypes. تمام؟ so D and E are يعني both of them are the same. So like strep pneumo has peptidoglycan, has a pilus protein, but they're not the one that are behind the serotypes. Yalla, next. Which one of the following microorganisms can be part of the normal vaginal flora, causing meningitis in newborns?
meningitis. I think it was hold on group B. Well,
Yes, صح. So it's basically Streptococcus agalactia. Streptococcus agalactia, if you guys have watched Sketchy, you remember the baby with the like on هيك ما بعرف, it's something on like Mars مدري وين بالفضاء, and he's holding a hippo. Like, so basically group B strep, which is strep agalactia, is part of our normal vaginal flora. And basically they, before like a pregnant woman gives birth, they test for GBS, and if it's high, okay, they before like giving birth, they give her penicillin G specifically to like prevent meningitis from happening. تمام تمام يلا. Moving on, a 35-year-old contact lens user presents to the ophthalmology clinic with eye pain, redness, blurred vision, and sensitivity to light. She reports that her symptoms started a week after she went swimming with her contact lenses on. So, on examination, the cornea appears inflamed. Which of the following is the most likely diagnosis for this patient?
كانت amoeba.
Perfect. طب هلا إذا we read the next, عنا bacterial or viral conjunctivitis and allergic. Why can it not be any of these?
I guess because it's like contact lenses.
Okay, you're right. كمان because we have blurred vision, okay? So it's extreme. يعني لأنه يعني you might مثلا, some people might think إنه oh, like why is it not conjunctivitis or bacterial, you know? فthink of it إنه نحن عنا blurred vision و sensitivity to light. This is extreme, okay? That's why. And she, as you said, she has contact lenses and she went swimming with her contact lenses on. So we think of acanthamoeba. طيب, which group of individuals are at highest risk for developing granulomatous amoebic encephalitis?
So this has to be so this is probably Nilaria, صح؟ لا أصبر.
Yeah.
Wait, I think this is D or C.
You think what? Which one?
Either D or C.
Either D or C. All right. طيب, هلا the name sounds fancy and it sounds scary. But when we see scary, fancy names, what's the first thing that you might think of? Like people that are, do you think who are at more risk? Because children, their immune system is like stronger than people that have immunocompromised patients, right?
So C.
So it's safe, exactly. So guys, whenever you see something that's very like fancy and like long and whatever, no, it's rare. And because it's rare, in all cases, like حتى شيلكم عن this, always immunocompromised patients are the people that were scared or that are at highest risk for developing any kind of disease. All right. But if you get a question and you're not even sure what the issue is or what like the disease is or like who is at the highest risk, إذا كان في عنا immunocompromised, we always choose immunocompromised. All right. تمام. Next, in addition to the eye, which body system can be affected by acanthamoeba if it was disseminated?
B.
Yes, you're right. Perfect. Yalla, moving on. Which one of the following is a large gram-positive rod? Keep in mind, gram-positive rod that causes necrosis by producing an exotoxin that degrades lecithin.
So first, it's either Corneobacterium or Clostridium.
All right. طيب bacillus أصلا bacillus they cause pulmonary things, right? So they have nothing to do with this. Listeria causes like طيب هلا كيف بدنا نفرق بين cornea bacterium diphtheria and clostridium perfringens؟ هل نحن عم نحكي عن necrosis of the tissue, right? So
Yes.
necrosis of the tissue, this means it's continuous in a way. Cornea bacteria diphtheria, what does it usually cause?
Pseudo, like basically what a pseudo membrane.
Okay, pseudomembranes, where in the mucocutaneous tissue, right?
Yes.
So basically, it's less likely for Corneobacterium diphtheria to be the cause of the necrosis of tissue, right? So بقي عنا Clostridium perfringens. So it's probably Clostridium perfringens because أصلا if you think of it, like necrosis of tissue usually happens مثلا هو أو مثلا Clostridium perfringens specifically usually happens when we have like a wound injury or like a nail that goes into it, and then it would be like whatever caused this injury is contaminated with Clostridium perfringens, and that's the reason for the necrosis of the tissue. All right? Perfect. طيب يلا, which one of the following laboratory tests is the most appropriate to distinguish Streptococcus pyogenes from other beta hemolytic streptococci? So how will I know it's Streptococcus pyogenes?
Uh, D or E. D.
D or E? طيب احنا مو قبل شوي حكينا عن Streptococcus pyogenes.
Yes, it
Yeah,
was.
it was resistant to optician, right? Sorry,
Yeah.
to inhibited, no, it was resistant to bacitracin. So the answer is bacitracin. So we will give it bacitracin. If it doesn't work, then it's probably Streptococcus pyogenes. If it's not resistant to bacitracin, then it's not Streptococcus pyogenes. It's another beta hemolytic streptococci. All right? تمام. يلا. A 34-year-old man comes to the physician for a 2-month history of an itchy rash on his forearm. فعنا a rash. He feels well otherwise, and he has ما في لا fever ولا chills. He returned from an archaeological expedition to Guatemala 4 months ago. Skin examination shows a solitary brown pink colored plaque with central ulceration. Okay? وعندنا axillary lymphadenopathy. So it's something that كمان it's causing rash and lymphadenopathy. حلو? We took a biopsy and that's what we saw. فأنتوا from the picture, what's the first thing that you think of?
Amastogotes and macrophages.
Okay, Slay. So what is this?
Leishmania.
What is it?
Leishmania.
Perfect. So it's E. Right. يلا, moving on. But guys, it's clear, صح? Like عندنا lymphadenopathy, ulceration, rash, and as you said, macrophage with yeah. يعني as you said, like the leishmania is inside the macrophages. Okay, slay. طيب يلا, which one of the following is a club-shaped gram-positive rod تمام that causes disease by producing an exotoxin that kills cells by inhibiting elongation factor 2?
Corneobacterium.
Slay. All right. A flight attendant who works trips to Latin America presents with fever, right upper abdominal pain, again fever, and blood-streaked diarrhea. So عندنا a blood-streaked diarrhea. Okay, and we have fever. A stain sample under oil immersion reveals the diagnostic stage, the thing we see here. If the treatment were to be withheld, what would the flight attendant be in danger of developing? So if we don't treat this patient, what would she develop?
Liver abscess, since this would be entamoeba.
You're right. Okay, perfect. Yalla, moving on. A U.S. Army Special Forces unit is considering establishing a training center in a tropical forested region of Central America. تمام؟ a monitor team of army physicians and public health officers note that a substantial number of children and young adults are afflicted with chronic sores. So I know a lot of people have chronic sores, like the ones in the photograph. Do you see the photograph? Which of the following measures is the most relevant in preventing the disease from becoming a problem in the US soldiers? So we're scared that the US soldiers will get this. What is this?
Hold on, this is something cutaneous or subcutaneous.
Okay, so this is cutaneous. So cutaneous, what are the things that usually that happen cutaneously? And we
Leishmania.
can see they have, okay, so this is okay, cutaneous leishmania. حلو. طيب, how will we prevent cutaneous leishmania? How is it transmitted?
I guess it's transmitted by sand flies. The answer is D.
You're right. So because it's transmitted, so the vector is the sand flies, we want to protect the soldier from these sand flies, and that's how we prevent cutaneous leishmania from happening. Perfect. Excellent, guys. Yalla, a 45-year-old man who emigrated from, wait 1 second. Okay. So he emigrated to the United States 5 years ago, sustained a puncture injury of the lower part of, okay, wait. He has a puncture injury, okay, in the lower part of his right leg, blah, blah, blah. There's a lot of haki. 6 days later, he noticed spasms. So we have spasms in the muscle. All right. And then the spasms, as we went, they were progressively increasing. All right. Then at day 8, which is today, when who showed up like to the emergency, he was unable to open his jaw and came to the emergency department. All right. In the emergency department, you see a man who's alert and lying quietly in bed. A door slams down the hall, and suddenly he has general muscle spasm with arcing of his back. What is the correct diagnosis? What do you think?
Tetanus.
Why?
Spasmic paralysis.
Okay, perfect. Hatta he has the classical trismus, which is basically an inability of opening the mouth. Tamam? So inability to open his jaw because of the trismus كمان is a very, very high yield, like something specific for tetanus, all right? Yalla, a 48-year-old substance farmer from rural Brazil dies because of a heart failure. His autopsy showed a greatly enlarged heart. What was the vector for the most likely infectious agent that may have been responsible for his death? So what's actually the diagnosis?
I guess this would be, I think this would be Chagas disease.
You're right. It's Chagas disease. Tamam. Chagas disease. How is it transmitted? Through which vector?
Reduvid.
Reduvid. Slay. Yalla, let's go on. Which of the following Plasmodium species has recently been found to infect humans?
A.
Yeah. You know, I got this question in my exam.
And yeah, I've seen a lot of. I went through all of them.
Yeah, I've seen this. This one, صراحة, when I saw it, I remembered my exam because I was there and we were so confused because no one knew the answer, but it was literally mentioned in the lecture. Anyways, yalla, you're a public health epidemiologist who's called to investigate an outbreak of bloody diarrhea in 16 people, okay? You find that it's associated with eating rare hamburgers in a particular fast food restaurant. A culture of the remaining uncooked hamburger grows a gram-negative rod. So we have a gram-negative rod. It produces a dark purple colony, so a dark purple colony on EMB agar, all right? Which is evidence that it ferments lactose. So it's a gram-negative rod. It causes, wait, what does it cause? It causes bloody diarrhea and it ferments lactose. So what do you think?
A. E. coli.
You're right. So basically this is enterohemorrhagic. No, not, sorry, enterotoxigenic, right?
Wait, I think since there is bloody diarrhea, so it's the 0157 at
Yeah. The OH1, yeah. Okay, slay. بس أصلا everything else كمان like shows like signs that it's E. coli. It's gram negative. Okay, most of these are gram negative, but Shigella does not cause how does Shigella cause bloody diarrhea? Like what's the cause?
Shiga toxin.
Shiga toxin. Okay, and how is it transmitted?
How was it transmitted? I think droplets. ماني متأكد.
Okay, I'm not sure how it's transmitted. Wait, let's check together. Why is it not? Okay, so for Shigella specifically, okay, it's non-lactose fermenting. Oh, it's easy. So Salmonella, Enteritica, and Typhi, and this Shigella, all of these, they do not ferment lactose. And because they do not ferment lactose, they're not, we're not even going to think of them. All right. And Vibrio cholera, we know that cholera is watery diarrhea. It's not, what is it called? It's not bloody diarrhea. Okay. تمام يلا. A 28-year-old pregnant woman presents to her obstetrician for a routine checkup. She mentions that she's recently adopted a kitten and she's been cleaning its litter box. So basically, we have a kitten. Oh, act like you didn't see anything. Okay. So we have a kitten, tamam, and she was cleaning the litter box. She has mild flu-like symptoms. The obstetrician is concerned about the possibility of Toxoplasma gondii. Okay, because she was exposed to the cat feces. What step in the life cycle of Toxoplasma gondii is most likely occurring in the woman's body following exposure to cat feces?
I guess it would be C. عشان first I guess A, release of sporozoites. I don't think like sporozoites directly. Ingestion and release of radizoids in the liver. No, عشان you didn't eat. C, rupture of oocysts in small intestine and invasion by taphozoids. So
You're
yeah.
right. It is C. And if you see, this is basically the tissue cyst that would rupture, and then the tachyzoids are going to leave, all right, and cause the symptoms that the pregnant woman is having. So, what diagnostic tests should be performed to confirm Toxoplasma gondii?
Toxoplasma, I think it would be C
Culture
or
of tissue
B.
sample.
Wait, B as well. Immune. Wait, no. Toxoplasma. First, CBC, I don't think so.
Okay, CBC is not correct. You're right.
Uh, Immunofluorescence, I don't think it's correct.
Yeah, me too, because immunofluorescence has nothing to do with this. So it's either a culture of the tissue sample or PCR of blood or amniotic fluid. And the thing is, all right, the thing is, like the tissue sample, how would we know where the, you know, like
So
the,
yeah, I guess PCR.
so because we know in Toxoplasma gondii, isn't it going to be like transmitted to the child?
Yeah.
So
The IgM rather than IgG.
yeah, exactly. So basically, that's why we take a PCR sample of the blood. And when we take this PCR sample, it would show us basically, we have an infection. All right. The culture of tissue sample, we don't know exactly where it is because, you get me? Like, how would we know? Like, it's not a rash or like a wound or something, Tamam. Is it clear?
Yes.
Okay. Which of the following is true regarding the transmission of Toxoplasma gondii to the fetus?
B.
You're right. So basically, the transmission of the disease only happens if the patient was infected during the pregnancy, like the current one, if or she got, she had it, but then she recovered and got reinfected. You get me? But if she had the disease before being pregnant, the baby is not going to be affected. Yalla, next. Your patient is a 25-year-old woman with pain on urination, cloudy urine, okay? No fever or flank pain. She has not been hospitalized. You think she probably has cystitis, infection of the urinary bladder. A gram stain of the urine revealed gram-negative rods, all right? We have colorless colonies and urease test was positive. Okay, and we have swarming motility. It's shouting. What is it shouting?
Proteus.
Exactly. طيب يلا. Next, a 35-year-old man from a rural area in East Africa presents to the clinic with fever, severe headaches, and joint pain. So we have fever, severe headaches, joint pain. Over the past few weeks, he also experienced confusion and excessive daytime sleepiness. He reports frequent exposure to cattle. While working on his family farm, the physician suspects African trypanosomiasis or sleeping sickness, and he orders a diagnostic test. Which one of these do you think is the causative agent?
B.
B?
Yeah.
Why B, not D, or not C?
I guess the third word would just mean based on location in the world.
Oh, basically, it's C. Why? Because the third word is rhodesiency, which means rodent, which are basically the cattle, you know? Because he's exposed to the cattle, which are like, like cows and horses and whatever. They're usually called command rodents, okay? But that's why it's C. Right, you're right for thinking, it might be the place. Anyways, moving on. What is the infective form of Trypanosoma brucei that is transmitted
Just
to
like
human?
the
You're right. Perfect. Yalla, what's the pathogenesis of African trypanosomiasis once the infective form enters the human host? So what happens?
I guess C or A.
C or A?
Wait, hold on. I guess it could also be B at the same time. Ashan brain is also affected here.
Okay. Let's see.
I guess it would be B.
Yeah, you're right. Because it's going to be like kind of a widespread disease. Okay. So after it enters the human host, it will spread and goes everywhere, basically. And as you said, the brain is affected, so B is the best choice. All right. And this is the trypanosoma. It looks like, I don't know, what does it look like? But like it looks like a crumbled like pasta. I don't know. Anyways, your patient is a 6-year-old boy who's complaining that his ear hurts. So عندنا pain in the ear. His mother says that it began yesterday and that he has a fever. All right. On physical exam, you see a perforated eardrum that is exuding a small amount of pus. So do you know what infection is this? I don't think you guys know. You didn't take HNS, but this is otitis media. All right. Did you
Uh,
guys take this?
I am not sure.
I don't think you did, but I'm pretty sure you guys know what caused this. So basically, you take the sample of pus, and there's a grams. You do a gram stain, and you can see that they are cocoa bacillary rods. All right, and it's gram negative. There is no growth on a blood agar plate, but a chocolate agar plate supplemented with X and V factors grows small gray colonies. Which one of the following bacteria is most likely the cause of otitis media?
Could this be B?
Haemophilus influenza. Why?
I guess X and V factors.
Exactly, you're right. And another thing, no, the most common cause of otitis media is Haemophilus influenza. But into from this question, because you never took otitis media, you can easily figure it out from X and V, اللي هو NAD and Hematin, I think, right? Something like that. So because this is like you have the idea of no, this bacteria requires like a specific what is it called? Agar to grow in. تمام? Oh, they gave you the details for it, so that's how you can know it's Haemophilus influenza. Next, a 21-year-old college student presents to the emergency department with severe headache, nausea, and fever. He mentions that a week ago he was swimming in a warm freshwater lake. A neurological examination revealed signs of meningeal irritation. A lumbar puncture is performed and cerebrospinal fluid is collected for analysis. The doctor is suspecting amoebic brain infection. So which one of these usually causes like meningitis or like brain problem?
Naglera.
Okay. Okay. Which of the following is the primary diagnostic method for conforming Naegleria fowleri?
B.
Exactly. So it's since it's something that has to do with the brain, we will look for like things in the CSF. طيب, what preventive measure can reduce the risk of Naegleria fowleri infection?
I guess wait, A or C?
A or C?
C.
Okay. It's yeah, exactly. It is C because yani it's more about swimming in the pool, right? So it's yani, okay, it's the idea of because you know how it is transmitted? It's not transmitted because you drink it. It's more of like it crawls into your brain, you know? So that's why you have to make sure and the swimming pools or anything that is derived from fresh water is properly monitored and chlorinated because it will kill the bacteria, not the bacteria. It's an amoeba. It will kill the amoeba and it will protect us because he اصلا while swimming it will just go into your nose up into the brain, which is scary. Anyways, a 27-year-old woman is admitted to the hospital because of fever. We have anorexia, headache, weakness, and altered mental status. All right. She works for an airline flying between the Indian subcontinent and other places in Southeast Asia. 10 days before admission, she had a diarrheal illness that lasted for about 36 hours. She has been constipated for the past 3 days. So we have constipation, diarrhea, and she has fever. She knows that who she is and where she is, but does not know the date. So she's confused. She's picking at the bedclothes. Rose spots are seen on her trunk. The most likely cause of her illness is
Wait, what is rose spots again?
rose spots. They're kind of like a rash. It's not exactly a rash, but like they're very specific for something. Like for like they're wait, let me see if I can search for a photo.
Hello.
Yeah, it is salmonella, but is it the typhi or the typhimurium?
I think typhoid.
You're right. So basically, enterotoxigenic E. coli is not going to cause the raw spots. Okay, nothing is going to cause the raw spots except for salmonella. So how do we know if it's typhi or typhimurium? Okay, so it's because of the like she has headache, weakness, she has altered mental status. So it's kind of a generalized disease. It's not only because typhimurium or like the normal like salmonella that's not related to the typhoid fever usually only presents with gastrointestinal problems, which is the diarrhea. Tamam? Is it clear? And the rose spots are very, very like pathognomic. Why? Because you know how like salmon, you know how the salmon is pink? But like rose spots, they're like spots that yani, can remind you of salmonella because salmonella is from salmon and it's like pink, you know? Anyways, let's move on. A 52-year-old man presents to the emergency room with fever, chills, and fatigue, وعنده كمان muscle ache. He recently returned from a hiking trip in a wooded area in the northern east United States. Physical examination shows no rash, but he mentions pulling a small tick off his leg a week ago. Laboratory test showed anemia and thrombocytopenia. What do you think it is?
Babesia.
You're right. But why is it not any of these? Like, why is it not rickettsia? Did you guys take rickettsia or no?
Yes.
But why is it not?
There's no hemorrhagic rashes.
You're right. There's no rash. That's why it's not rickettsia. And Borrelia burgdorferi كمان فيها rashes, so we don't have rash here. And in Plasmodium, why is it not Plasmodium vivax?
Since it was a tick, not a mosquito.
Exactly. So that's why it's not Plasmodium. Slay. Yalla, which diagnostic method is most appropriate for confirming a diagnosis of babesiosis?
See,
صح. What do you see in the GAMSA? What will you see?
we would see a Maltese cross.
Exactly. And this Maltese cross is what will help you differentiate it from, which is right here. This is what's going to help you differentiate it from malaria. Okay? غير انه هلا هون بالquestion they said انه it was a tick, not like a mosquito. But if they مثلا like they're not gonna trick you too much. They're going to either put a picture or like this question, they'll show you another vector is different. تمام؟ يلا. A 4-year-old boy from Kansas City who recently started attending preschool and after-school daycare is brought to his pediatrician for a diarrheal illness. So he has diarrhea and fever. Okay? Diarrhea, we have fever, severe lower abdominal pain, and initially watery diarrhea. His mother becomes concerned because the stools are now blood tinged. So it was watery and became bloody. Anyways, the child appears quite ill. The mother reports that two other children who attended the same after-school daycare have recently had diarrheal disease, and one of whom likewise had bloody stools. Which of the following is most likely the pathogen that can cause this illness in these patients?
Shigella.
Shigella. You are right. أصلا this sounds weird. We never heard of it. Salmonella typhoid is gonna cause fever, and the typhoid is gonna be totally different. All right, and it's gonna be watery. It wasn't bloody. Um, yeah. So that's the Klebsiella. Kid, it's not Klebsiella. Next, a 7-year-old girl presents to the clinic with complaints of an intense itching around the anal area, particularly at night. Her parents mentioned that she has been having difficulty sleeping. She seems more irritable. They have recently went to a camping site where they shared a bathroom with the facilities. Okay, they shared a bathroom. Which of the following is the most likely diagnosis?
Probis.
You're right, because it's so like so specific. You know, itching around the anal area specifically at night. And why is it at night?
عشان the female worm just goes to that area and just like lays its egg at that time.
Yeah, exactly. Slave.
Scotch
تمام يلا.
tape.
Two.
Scotch
Yeah,
tape.
yeah, you're right. Scotch tape. What's the mode of transmission for Enterobius vermicularis?
B.
You're right. So حتى it's not only the fecal oral route, it's even the fomites and the inhalation of eggs. So basically, you know how like okay, the main one is fecal oral route because they were literally like hiking, okay, or camping, and they all shared the same bathroom. It wasn't hygienic. And another thing you have to keep in mind the fomites because the eggs are being laid at a kind of like the surface of the baby, you know, and if the baby's itching, it's going to kind of disperse the eggs into the blanket, okay? Fomites are usually whatever is left behind on like the blanket, the clothes, whatever. So basically, if the mother is going to like tidy up the bed and she's or like she wants to change the sheets and she just kind of like you know how you like like you're like trying to spread the sheets or like trying to remove air from it or whatever, but it's going to disperse the eggs and you can easily just inhale them and get the same thing. Just so you guys like, I'm just explaining it so you don't forget it. And these are the eggs of Enteromobius, whatever, vermicularis, and this is the Scotch tape disease, not disease, the Scotch tape like diagnostic test. تمام؟ Yalla, moving on. A 9-year-old child is brought to the clinic by his parents due to fatigue, abdominal pain, and rectal discomfort. The parents report that the child has been experiencing loose stools with occasional blood, so عندنا bloody diarrhea. On examination, the physician notes signs of mild anemia and observes a partial rectal prolapse. The child lives in an area where sanitation is limited. So what do you think it is?
Vickers.
You're right. And what made you think that?
Rectal prolapse.
Anemia, صح. And أصلا we just talked about enterobius. It doesn't cause it causes anal itching and it has nothing to do with that. Hookworm infection and Ascaris lumbricoids, they don't cause bloody stools, right? And rectal prolapse, obviously. So what's the primary diagnostic method for confirming a trichiura? I don't know how to explain it.
A stool examination.
You're right. So we look for the eggs inside the stool to make sure and know this patient actually has this. What's the infective stage of trichiuria? That leads
Embryonated.
embryonated eggs. صح. Why is it not unembryonated?
I guess because the unembryonated would not cause infection عشان there is nothing in the eggs.
Exactly. So unembryonated eggs means an empty egg, so it's not going to cause an infection. The larva and the adult worm are not gonna, it won't cause the infection, you know, because we're talking about the infective stage. Anyways, you're right, فصح. And this is the egg, all right?
Bipolar plug.
How it looks like. Yeah, I always thought of it like, it looks like I know it's disgusting, but أنا like the idea it's like كأنه it's like صحن وفيه أكل you know like جريش or whatever or like do you get me it looks
Yeah.
like that it looks like صحن تمسكه من الطرفين yeah anyways and this is the worm if you do an endoscopy you can see it enjoying in the intestine. Next, a 55-year-old homeless man, mechanical intubation, mechanical ventilation. All right. A gram stain of his sputum revealed numerous polymorphonuclear leukocytes in gram-negative rods. And he has a capsule. The organism is a lactose fermenter and is very mucoid. It's non-motile and lysine decarboxylase positive. What's the most likely organism causing the man's illness?
Uh, I guess it would be proteins.
But it's an infection in the lung. Proteus causes kidney issues.
Klebsiella.
Yeah, it is Klebsiella. And another thing that is very, very pathognomic, mucoid. Mucoid. And it's in a patient that is hospitalized. You know how there is hospital acquired pneumonia and community acquired pneumonia. So Klebsiella is the one of the organisms that causes hospital acquired pneumonia. And it is a lactose fermenter and it's very mucoid and it's like this is a very 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 important like characteristics plus the patient is on mechanical ventilation and I'm not sure if you watched the sketchy of it but I remember the sketchy of it it's the thing happened in a hospital and the patient was like with on a like mechanical ventilator you know so that's how you can like know it's in Klebsiella and Proteus causes basically staghorn calculi in the kidneys. Serratia is another like microorganism that can cause hospital acquired pneumonia, but it's not mucoid and it's not lactose fermenter, so you don't think of it. This صراحة I don't know what it is. ده B ولا E I know. That's how we can like that's I'm trying to show you guys that even if you don't know the information, you can try to like wriggle your way around it, you know? يلا next, a 6-year-old child is brought to the clinic by her parents due to abdominal pain, nausea, and occasional vomiting. Anyways, the parents mentioned that the child has a history of playing outside in the playground on the soil. Physical examination reveals mild abdominal distension and stool examination is ordered. What do you think this is?
Hookworm.
Why?
In penetration and playing on soil.
You're right. Oh wait, no, you're not.
Wait, how come scarce?
Basically, it's because of the wait, let me just show you why. So basically, it's because of the fecal-oral route of transmission. Because the hookworm, isn't it? How do you like in the hookworm? Don't you basically isn't the transmission? You know, basically you're walking on the soil and then it goes into the hay. For this is a child and he's having vomiting, abdominal pain. These things show, and basically he ate something from the soil which caused that. You know.
But at the same time, he didn't ingest anything from it. So I didn't say that.
Yeah, I get you. Maybe the question is not clear. It's okay. Like I understand why you said hookworm, but هن like that's what they wanted you to think of, you know, and like playing outside. Because he's a child, children used to usually like they ingest anything on they see. خصوصي إنه at that age, 6-year-old, where the baby is playful, you know. But I understand why you said hookworm because كمان hookworm usually goes from the like the soil and so on. It's okay. طيب, what is the primary diagnostic stage for Ascaris lumbricoids?
Eggs.
You're right. What is the habitat of the adult Ascaris lumbricoids?
Colon.
Two.
Wait, why not? Wait, hold on. Small intestine. Yeah, small intestine.
It is the small intestine because remember how you basically like you ingest it and then you cough it up? لا بالعكس.
Wait, hold on. I guess
I guess
Yeah,
it's wrong. It's wrong. No, لا. Wait, you ingest it, but then you cough it up and it goes into the lungs.
لا
Yeah,
لا
it has to be the lungs. No?
لا, لا أول شيء you swallow it, then it enters the lung. أول شيء they go to hepatic portal through intestinal wall, بعدين بيروحوا على lungs, بعدين they are coughed up and then swallowed again. Then they
Yeah,
go
yeah.
to the small intestine.
صح صح صح. You're right. That's why it is in the small intestine. I got confused for a second, Marco. Anyways, it makes sense why small intestine because at the end هنا they want the habitat يعني وكاتبين the adult, you know. فبالأخير it will end up in the small intestine. So this is the eggs, okay, and these are the like the worms. تمام? Is this clear? يلا
Yeah,
let's move. طيب, okay. So, what is this? Like when you look at this, what do you think?
trichomonas,
Exactly. What is the host?
human.
Perfect. And what is the infective stage?
The trophozoites. It's only trophozoites.
It's only the trophozoites. صح. You're right. تمام. Let us move on. That's all يعني there for that side. Anyways, a 37-year-old male is seen at a sexually transmitted disease clinic, okay, for treatment of gonorrhea. Prior treatment for this disease have successfully eradicated the organism. However, the man has not changed his behavior and has been repeatedly reinfected, which is the most important strategy by the organism, which enables it to be repeatedly infected. So basically, and he already had it once. And you know how like our immune system, if you have it like a bacteria once, you can fight it off. But in here, it's not being fought off. Why?
I guess it's E.
E?
Wait, hold on. No, it's not A. It should be IgA. I think it's D.
Okay. But is it capsulated?
I mean, yeah, it does have a capsule.
Yeah, but it's not polysaccharide capsule. That's why it's not D.
Oh.
Okay. And why is it شو اسمه? What is it called? The intracellular growth in alveolar macrophages, it doesn't grow intracellularly, right? Like it doesn't go يعني it grows intracellularly but not in the alveolar macrophages, so it's not C, right? طيب, induction of immune suppression, it does not suppress the immune system, does it?
No, it doesn't.
Or like يعني even if it does, it's not the main thing that causes gonorrhea to be high. طيب, I'll help you with one idea اللي هي basically إنه نحن عنا multiple serotypes for gonorrhea, or like هي لأنه this is caused by, you get me? So, and it's like you know how we don't have a vaccination for Neisseria gonorrhea? So what do you think is the cause?
Genetic variation.
Yeah. So it's able to keep on changing the proteins that are on the surface. Because it keeps on changing the proteins on the surface, it will come back to this man and it will keep on reinfecting him no matter how many times he tries to form like cell-mediated immunity and humoral immunity against it. Okay? Is it clear?
Yeah.
طيب, a 30-year-old woman presents to her primary care physician with complaints of abdominal discomfort, intermittent diarrhea, and unexplained weight loss. Okay? She mentions that she recently returned on a trip from a rural area where she consumed undercooked beef. On examination, she has mild tenderness in the epigastric region, but no rebound tenderness. So what do you think this is?
Tanya Tadinata.
You're right, because it's undercooked beef, not pork. طيب, what's the diagnostic method would be appropriate for confirming the diagnosis of a tinea saginata?
Soon.
Slay. تمام. What are the characteristics of the proglottids of Tania saginata as compared to those as Tania solium?
Tanya saginata usually has more than 15 proglottids, and sodium has less than 15.
So it's B. And okay, tell me, which one is this?
This is sodium, عشان you can see the booklets and weird things.
Yeah. Looks like an alien بصراحة يعني. This looks like a lizard. These are the eyes. Anyways, this looks like, plankton
Yeah,
in
yeah.
SpongeBob. I don't know why it reminds me of him. Anyways, what clinical condition can tinea solium cause that is not associated with tinea saginata?
Cirrhosis.
Yeah, cystic uricoses, whatever. But this is happened. This usually where?
This
Here
is,
everywhere. It's
yeah,
really when.
I guess in the United States.
Yeah, yeah. I don't mean country. I mean organ. Which organ?
Liver.
Okay. It's like the most common يعني اللي انت لما تشوفه you know for a fact that this is tinea.
Uh, I guess the bones ولا brain.
It's the brain. حتى like it's أصلا يعني very common. It's called like not very common, but it's the most common one, and it's called neurocystic sclerosis. Okay, this is the one that they get scared from the most. But when we do studies for neurocystic sclerosis, what do you see usually?
Calcified lesions.
You do see that اللي هو basically بس don't you see كمان السكولكس تبع
Yes.
so this is more like this is a better answer than B, because هون it's only the calcified lesions but no نحن we see the calcified lesions and we see the colics طبعا not in like this is like an MRI and it's not like really close to the thing فهلا أكيد we can't see anything here but this is neurocystic sclerosis and these are the basically the eggs تمام يلا physicians and state epidemiologists investigate a cluster of acute diarrheal cases in children. They all went to the same preschool. تمام? The children presented with fever, acute episodes of bloody diarrhea, and petechial rash or purpura. Two of the children have scant urine output and are showing signs of renal failure. Focal leukocytes and parasites are absent in microscopic smears, and no obvious pathogens are identified using standard microbiological media. What's the most common infectious agent consistent with this clinical picture? So, what do you think it is?
So first we know that's body diarrhea, so that only leaves us with B and D.
Say, you're right. طيب B ولا D?
B ولا D, I guess it could be Shigella. ولا E. coli عشان fever.
It's E. coli عشان في renal involvement. It's the hemorrhagic uremic syndrome, HUS. So we have people that have rash, renal failure, and scanty urine, which is basically they're not able to like they're not able to form urine. They don't form any urine. It's usually called oligouria or anuria. تمام. So we have لما تشوفوا renal involvement وعنا rash وعنا what is it called? Bloody diarrhea, then directly think of enterohemorrhagic E. coli because of HUS. Okay?
Um,
Is it clear?
yes,
It was mentioned in your lectures, right?
I think so. I don't remember. I have to review
Yeah.
everything.
Oh, this is pre-midterm, and I just wanted to refresh your memories. Like I'm not sure how يعني heavy will your exam be on pre-midterm material, but here and there, sometimes they're moody, sometimes they get a lot of pre-mid material, sometimes they get a lot of post-midterm, يعني you never really know. Anyways, a 40-year-old woman presents to the clinic with vague abdominal pain and nausea that persisted for several months. During her history, she mentions that she often travels to rural areas where she helps on a farm. So she goes to a farm that raises sheep and allows her dog to roam freely. She also recalls that she occasionally eats raw vegetables grown in her garden, which is fertilized with manure from livestock. A recent abdominal ultrasound shows a large cystic lesion in the liver. So Anna, it might be a hiatus cyst. So what do you think this is? It's so easy.
Pneumococcus granulosis.
Exactly. It's B. طب why is it not multilocularis?
Uh, I guess عشان why is it not multi? Uh, to be honest, I have no idea.
Okay, so basically, because we only have one cyst that is in the liver, okay? Multilocularis means we have multiple places where we have like the cysts. You get?
تمام.
That's how you know, يعني. Okay. I remembered what this is. So, okay, what is this organism?
All right. The middle one.
Hmm.
This is Cystosoma japonicum. The one on the left
Okay.
is Cystosoma hematobium. The right one is Cystosoma mansoni.
Okay. So basically, كأنه أنت قلبتهم. Wait.
لا لا لا، اللي بالوسط قلت
لا,
japonicum.
Japonicum is right. But the one, wait, let's go back.
لا، أنا قلت اللي على اليسار هيماتوبيوم.
اللي على يسار hematobium, the right one, this one, right?
أيوه لا اليسار.
Okay, sorry. Oh my God, that's embarrassing. Okay, اليسار.
أيوه.
طيب, this is hematobium.
Yes.
Okay, and you're right. Hematobium is the one that's straight. Okay. The one that's lateral is Mansoni. واللي صغيرة, it's basically Japonicum. تمام؟ طيب, how are they transmitted?
I guess snails is an intermediate host.
Did you read it?
لا.
Okay. But you're right. So basically, snails are usually the intermediate hosts. And do you know where do they reside?
Uh, what do you mean? Where do they reside? يعني
يعني
human body.
yeah,
ولا
in the human body, yeah.
the hematobium in the يعني somewhere in the
Okay,
blood
you're right.
blood supply,
Yeah,
and in the other two it's in the GI blood supply.
you're right. So hematobium is usually urinary bladder. طبعا all of them are in the veins, okay? Hematobium is in the urinary bladder. Japonicum is in small intestine and the liver. والمانسوني is in the colon. And you can think of it إنه مانسوني like بتحس كأنه عم يقولوا mansion, like it's big. And the colon is the big intestine. يعني something to try to help. Anyways, يلا, what structural component of fungal cells is a target for antifungal drugs, distinguishing them from human cells?
uh, I guess ergosterol.
Okay, and what is the name of the antibiotic that targets it?
Amphotericin.
Yeah, amphotericin B. Yeah, you're right. طيب, in a fungal culture, what would be the distinguishing characteristic of zygomycota under microscopic examination?
um, I think A.
بالعكس, it's B.
B.
Because it's aseptate. So zygomycota is aseptate. You can think of it Z and A. So A to Z. Aseptate hyphae, zygomycota. تمام؟ طيب يلا, 1 week post-delivery, an infant boy becomes extremely irritable and continuously rubs his right eye. So the problem is in the eye, which contains a mucopurulent exudate. An examination of the eye shows papilla on the conjunctiva. No bacteria are seen. What's the most likely causative infectious agent?
So since no bacteria, wait, hold on. So what is the most likely ones?
So basically, this is a
Like
newly born baby and he has a problem in his eye. عنده mucopurulent conjunctiva.
Candida.
Hmm.
Wait, hold on. Cytomegalovirus.
طيب, wait, ignore this. Okay? Ignore it. If this was not there, what would have you chose?
This was not there. I would choose the eye. So
طب سؤال انتوا ما اخذتوها انه basically if a mother has chlamydia And if she gave birth, it might increase the risk of a baby having basically mucopurulent conjunctivitis. I'm not sure يعني maybe انتوا ما أخدتوها.
To be honest, I forgot a lot of things.
طيب هلا I don't know صراحة guys if it's in your lectures or not. بس it's something that's يعني هي basically the biggest things that could show you is إن هو he's like a neonate, literally he's only 1 week old, he's rubbing his eye and it has mucopurulent discharge, and this is congenital like chlamydia. Like so basically when he's being born he contracts this, and he's going to have conjunctival like mucopurulent exudate, and usually they treat this with giving like erythromycin like مثل مرهم للعين for babies to prevent that, because it can cause like eventually it can really be harmful for the eye and it can cause blindness. تمام. Just keep it in mind. Maybe you guys did not take it, maybe you did, maybe it shows up in the exam and you guys know it from here. Anyways, it's okay. Moving on. يلا, a 35-year-old female patient with persistent rash on her scalp and hair loss in patches. Okay? She loses hair in patches وعندها a rash on her scalp. She reports that she has recently returned from a camping trip where she frequently interacted with soil and vegetation. Upon examination, and the dermatologist notes that the affected areas are scaling and the hair appears brittle and broken. Okay? KOH preparation reveals branching hyphae. The patient also mentions some itching in the affected areas, but no systemic symptoms. So what do you think it is?
Spontaneous.
You're right, because it's something that has to do with the skin. It's no systematic symptoms, and the KOH كمان عندنا KOH preparation shows the branching hyphae. طيب, what is the primary mechanism by which dermatophytes cause infection in the skin, hair, and nails?
C.
Keratin degradation, right? Because the skin, hair, and nails have a lot of keratin, and that's how they grow. تمام. In which scenario is patient most likely to develop systemic mycosis?
Systemic mycosis فيعني هذا cytoplasma صح؟
That's what?
Is it cytoplasma? أول شيء cytoplasma so
Yeah. Oh, yeah, yeah. Like something that's systemic. Cystoplasma, histoplasma, all of these, like the bad ones. So in which scenario is the patient most likely؟ قبل شو حكينا دائما the high risk patients مين هن؟
immunosuppressive.
Exactly. So anything that can be مثلا cutaneous and you're scared انه يصير systemic, أو anything يعني عادي, مثلا حتى an infection like مثلا staphylococcus aureus مثلا لما doesn't it cause cellulitis وهالقصص. But if you're scared إنه it can cause something systemic مثل sepsis or whatever, you always think of the people that are on immunosuppressive or they have an immunocompromised like they're immunocompromised or they're on treatment اللي هو هون that they suppress their immune system. تمام؟ طيب, which of the following source is most commonly associated with mycotoxin contamination?
Mycotoxin. Mycotoxin is basically the one for opportunistic صح؟
It's a kind with the opportunistic. Like it's not opportunistic, but it's something that you eat and it causes mycotoxin. مثل مثلا
Greens. C.
green beans. صح, perfect. طيب, aflatoxins, they're primarily associated with which type of health risk?
Liver.
صح. So these are things that you eat and that can increase your risk of having مثلا يا mycotoxicosis أو مثلا in this case مثلا aflatoxins can increase your risk of liver cancer. تمام. هلا, while on winter semester break, a 21-year-old male college student appears at his family physician's office with several skin lesions. تمام. They consist of a central pustule with a raised erythematous area. He reports that the only recent unusual activity that have involved skin exposure have been hot tub parties at his friend's cabin during the previous 2 weekends. So what do you think this is?
Uh, I think wait, could it be probably some B or C? No, probably papilloma. Hold on.
تمام. هلا هي it's something that's on the skin, so we don't think I don't think it's hyogenes صح؟
It's not spoilings.
And it's not papillomavirus because
أيوه.
طيب فبقي pseudomonas and staphylococcus aureus. هلا the key word here is hot tub, and I'm not sure if it was mentioned or not, but I think it should have been. Hot tub يعني عنا hot tub folliculitis. و hot tub folliculitis is caused by which of these? Do you know? هلا احنا شو؟
Pseudomonas.
Yes. Staphylococcus causes cellulitis and it can cause skin infections, but very specific to Pseudomonas as hot tub folliculitis. تمام؟ فإن أنتوا لما تشوفوا كلمة hot tub and something that is in the skin, directly think of Pseudomonas. Okay? تمام. A 35-year-old female presents to her physician with a persistent cough, fever, and weight loss over the past month. She has a history of asthma and has recently moved into an older apartment with visible mold growth. After a physical examination and chest x-ray reveals a pulmonary nodule, the physician suspects a fungal infection. So what's the best thing to figure out if this is a fungal infection?
B.
You're right, because it's something in the lungs. We will take the sputum and we'll put it on SPA. طيب, what is this?
This is Malassezia.
Slay. This is basically شو اسمه pityriasis versicolor, which means إنه نحن عنا regions of hypo and hyperpigmentation. يعني شايفين this is the normal skin, عنا regions of hyperpigmentation. We can see the things clearly بالwoods. It would show fluorescent stain in woods light. What is this? What can you like describe it? It has something that
Spaghetti and meatballs.
exactly. طيب, clavate macroconidia are characteristic of which of the following fungi?
A.
Epidermophyton flocosum. You're right, and this is the way it looks. So if you look at it, it's like smooth walled and it's like septated in a way. Anyways, a 34-year-old woman presents to the clinic with nodular lesions on her arm that developed after she handled rose bushes in her garden. And then after she checked the rose bushes, صار عندها ulcerated sores. So what do you think this is?
Ulcerated sores. Sporothrax.
صح. Sporotrichosis. And it's literally called the rose garden disease or whatever. If you look at this, it looks like a flower. صح?
Yeah.
So basically, when you see something like this that looks like a flower, or if you see roses, if you see like sores and ulcers, وهيك, just think of sporotrichosis. Type, what is this?
This is histoplasma.
صح. بس يعني that's a 60-year-old male with a history of lung disease presents with worsening respiratory symptoms. Sputum analysis reveals a septate hyphae with acute angle branching. So what do you think it is? Keyword, acute angle branching.
Candida. Oh,
Acute,
Aspergillus. Aspergillus.
yeah, it is aspergillus because it's acute. It's acute angle branching and we have respiratory symptoms, okay? it's septated. هون candida, but let's read the thing. We have an oral thrush, vaginal yeast infection, we have oval budding yeast cells. Okay, so this is a candida, and let's look at the difference. So this is the acute angle. That's less than, يعني إنه it's almost 60 or like less than 60. Okay, هون it's not يعني okay, I can see the branching, but it's not like it's not a characteristic of candida. What is a more like something that's very specific for candida is the pseudohyphae and the buddings اللي هن ال budding cells. تمام؟ يعني هنا إذا بدهم يقولوا لكم عن candida, they're gonna mention the pseudohyphae, they're gonna mention the budding cells, they're not gonna say acute angle branching. Acute angle branching, directly think of aspergillus. تمام؟ Okay. What role does the bacterial capsule play in bacterial pathogenicity?
Protects against phagocytosis.
What type of appendage is primarily involved in the exchange of genetic material between bacteria?
The line.
In the standard growth curve, what phase is characterized by no cell division but high, so عندنا no cell division but high metabolic activity?
Stationary. Oh, log.
Wait, so there's no cell division but عندنا high metabolic activity. It's the lag phase because يعني it's kind of preparing itself for the cell division. You get me? No, so it's lagging. The growth is lagging. You get me?
Yeah.
In the stationary, it's not, I don't think حتى حيكون في high metabolic activity. It's gonna be the cell, everything is gonna be equal. يعني حيكون في هيك equilibrium, you know? طيب, which phase of the growth curve is typically the most susceptible to antimicrobial agents?
Stationary.
Are you sure?
Wait, hold on. Wait, no. Log.
Yeah. So the log phase is usually the most active stage, and basically the bacteria will be the most vulnerable here. Antimicrobial agents are the best at this phase. So basically شايفين here, this is the stage where basically what is it called? It's vulnerable because ما في عنا عدد كبير. You get me? We can easily just like pew pew kill it. On, this is the lag phase. Okay, in the lag phase, there's no cell division. You barely have cells, but there is an activity. You can see how the activity is increasing. حتى شوي شوي the number is increasing. أو مو number, no, but like there's no cell division. بس إنه this is the activity, all right? So the activity is increasing. بعدين هون خلاص the cell number is high or everything is equal. You get me? What's the role of the enzyme enol pyruvate transferase in cell wall synthesis?
I B. لا wait. Wait. Transferase. So you're transferring. I guess B.
Flipping of sugars?
لا أو catalyzes.
Yeah, it is A. Because أصلا شوف, it has pyruvate and here UDP is basically pyruvate, okay? And it's transferring, so it will transfer NAG to NAM.
No.
طيب, which antibiotic targets enol pyruvate?
Cycloserine or phosphomycin.
Close enough, but it's not cycloserine.
It's phosphomycin.
Yeah, it is phosphomycin. So wait, so you see here, this is enol pyruvate transferase. So the NAG is going to be changed into NAM. And this antibiotic phosphomycin is going to inhibit this point. تمام? Cycloserine is going to inhibit the conversion of A-ALA to D-ALA. حلو؟ فphosphomycin is for enol pyruvate transferase. Is it clear? I'll take this as a yes. طيب, what's the target of beta-lactam antibiotics?
Target is the penicillin binding protein.
Slay. Wait, شو صار؟ Yeah, okay. طيب, which of the following antibiotics inhibit the enzyme phosphatase? It's أكيد not phosphomycin.
It's bacitracin.
You're right. And it's not penicillin because penicillin is going to inhibit شو?
Penicillin is going to bind to transpeptidase and inhibit.
Exactly. And Vanco is going to bind come on. Will it? No. What was Vanco? Vanco is going to bind.
Wait, I think it was the transpeptidase. لا مو
Yeah,
transpeptidase. The peptidoglycan
the
flipping.
glycan synthase. Yeah, exactly. Bacitracin is going to inhibit phosphate, which is going to change which is going to flip it in a way. Okay. Yeah, and Vanco is going to act on the peptidoglycan synthase. طيب, conjugative plasmids are defined by their ability to
I think C.
code for antibiotic resistance. No. Conjugative from the name and no conjugate, so it kind of like has to do with reproduction in a way, if you think of it that way, you know? Conjugative is going to have to do with genetic material exchange because if you think of like reproduction in a virus or in like bacteria and like a microorganism, it has to do with movement of genetic material, صح? But that's what
Yes.
I promote the transfer of genetic material. What's the primary role of transposon in bacterial genetics?
Bacterial genetics, I think B.
Exactly. It jumps from one DNA location to another, causing mutation. Transposon, also from the name trans. So it's like transportation from one place to another. Type, what is transformation in the contents of bacterial genetics?
Transformation, the process of, I think A.
Um, let's see. Nope. So transformation is so A is conjugation. صح؟ A is conjugation when two bacteria are together through the pili بصير في عنا genetic material change. B, transformation is when basically remember like this photo where the bacteria is there and then there's like a plasmid here and it's going to like engulf it. So this is transformation. تمام? Is it clear?
Yeah.
طيب, in generalized transduction, which statement is true? So transduction has to do with what?
With transfer of genes.
For what?
Transfer of gene.
صح. طيب, بس transfer of genes through what?
I guess no, generalized it would be by bacteria لا bacteriophage
صح.
لا bacteria
هلا generalized is by a bacteriophage. Specialized is اللي هو basically
lysogenic.
yeah, lysogenic, exactly. You know, I always thought these are not important, but they're very important. Like later on, حتى for your board exams, they're really, really important. But unfortunately, ما بعرف ليش we don't get enough ما بعرف like information عن هالموضوع. Anyways, why is horizontal gene transfer significant in bacteria?
I think B.
You're right. So horizontal gene transfer allows basically if I have uh, like a bacteria, like no bacteria, like a gene that helps me resist the antibiotic, I'm going to spread it, okay, or بصير في عنا horizontal gene transfer from one to another, so بصير في عنا spread of antibiotic resistance or virulence factors. Which of the following is an example of an inducible gene? Something that we induce.
B.
Exactly. So lactoferrin only is basically induced when we have lactose. طب يلا, let's match the plasmid with its function. تمام؟ يلا, fertility, what do you think it is?
Fertility it would be B.
Conjugation, صح. Resistance,
Resistance, antibiotic resistance.
yes. Col plasmids,
Cold plasmids, I think D.
yeah, because of colisins, which is kind of like col, and they kill. Col, kill. Degradative plasmids,
Digest.
okay, and then the virulence is for virulence factors. So you see كيف fertility conjugation هنيك لما كنا عم نحكي عن وينها conjugative plasmid, it has to do with the transfer of genetic material. This the process by which a bacterium transfers direct contact conjugation. تمام. Anyways, let's move on. Okay, what does viral tropism refer to?
The range of species.
صح. What is attributed to viral tropism? So what causes the formation of viral?
Spikes.
Type, which group of viruses contain examples such as HIV and has reverse transcription process?
Group 7.
Are you sure?
أنا الجروبات ماني حافظهم بس like I know that HIV is a retrovirus.
It is a retrovirus. So it's group 4. هلا بشرح فيه
Six.
السايد.
Six.
What's the role of reverse transcriptase in retrovirus?
Synthesizes DNA from RNA.
Does it synthesize or convert?
That converts.
Exactly, it converts because it's converts RNA. It's RNA dependent DNA.
Polymerase.
Yeah. So look at here. So this is the retrovirus. And by retrovirus, they're basically single-stranded RNA viruses that have a positive strand. Okay? So this is the provirus. تمام؟ هلا this provirus it usually wait. Sorry. دقيقة بس أظبط something. Okay. So أول شيء we're going to start from here. This is the HIV. Okay? It's a single-stranded RNA that is a positive strand. تجي reverse transcriptase, okay? And it's going to form a DNA منه اللي هو البروفيروس, okay? But this provirus بعدين is going to be integrated into our genome. Oh, it can cause basically to form an mRNA positive strand that will form the protein اللي هو basically the protein اللي will help the virus to kind of شو اسمه يعني to spread around. Yeah. لا هلا الانتجration happens like I don't think it's the protein that causes the integration. صراحة. I'm not 100% sure. But the provirus is going to integrate into the genome and cause latency. That's why HIV is a disease that is not يعني it's long term يعني it's chronic. يعني there's no لهلا there's no ما في treatment له. Okay? Like there are antivirals, but they're not like definite treatment. They just help decrease the progression of the disease. Okay? So this is group 4. لأنه guys هنا أنا برأيي بس طبعا يعني don't hold me accountable.
This is group 6.
Sorry, 6 move 4. Oh my God, that's embarrassing. Okay, anyways, group 6, okay. هن ما حيسألوا غير عن يعني this group is the group that they like the most because I checked the questions. Most of them are about reverse transcriptase. What does it do? What does the reverse transcriptase? What is reverse transcriptase? You know? So this is really the most important group out of all of the 6. مدري how many groups they are. Okay? تمام. هلا how does the mutation rate of RNA viruses compare to that of DNA viruses?
Faster mutation.
Yeah, صح. They have a faster mutation. طيب, what term is used to describe the diverse population of RNA viruses due to their high mutation rate?
Quasar.
What is an antigenic drift?
A. Wait, لا. أيوة لا. Accumulation of mutation.
هلا drift
أيوة.
has accumulation.
والشيفت بيكون
Is the reassortment. Which of the following viruses is primarily associated with antigenic drift?
Influenza.
That's why الانفلونزا virus هلا في a question about it. So what is antigenic shift? قلنا اللي هي it has to do with the reassortment. Which of the following statement is true regarding antigenic shift? It leads to the creation of a completely new virus.
Yes.
It's through the point. Okay, صح it is A. طيب. What is a potential public health implication of antigenic shift in influenza virus?
Vaccine, decreased vaccine effectiveness.
طيب, antigenic shift is most commonly observed in which type of viruses?
Segmented RNA.
طيب, where do DNA virus usually replicate?
DNA in nucleus, RNA in cytoplasm.
طيب, which one of the following shows the correct order of events concerning a viral agent?
A.
All of them starts with adsorption and then we do penetration, صح, uncoating, translation, and assembly. So which of the following describes the virus replication cycle?
C.
Yeah, so adsorption نفس الشيء, adsorption و penetration, this is all infection. uncoating, and then synthesis, which is translation, assembly, and then they release. And these are the steps. وطبعا sometimes they might ask you إنه uncoating is part of what the eclipse phase. They might ask about these phases ما بعرف الصراحة, but just keep them in mind إنه from penetration to before assembly, this is eclipse. بعدين it's productive. Everything before is nothing. طيب, which of the following viruses can be oncogenic? يعني it can cause a cancer.
A.
Yes. Do you know what cancer it causes ولا no?
Kaposi sarcoma.
طيب, which one of the following viruses causes a chronic infection?
Hepatitis B.
Okay. Why is it not hepatitis A?
Acute.
Okay, so what's the primary mode of transmission for norovirus, a member of the calciviruses?
Uh, no, hold on, respiratory.
What did you want to say بالأول?
Fecal.
Let's try. That's right. It is fecal. Always trust your first choice because it's the thing that comes directly from the memory. Norovirus causes gastroenteritis, so it would make sense إنه شو اسمه? It's fecal oral. طيب يلا, which virus is known to cause chickenpox and can reactivate later to form shingles?
Varicella zoster.
Which virus is most commonly associated with causing serious gastroenteritis outbreaks?
Rotavirus.
Which virus is known to cause chickenpox? Okay, well,
Varicella zoster.
again. Okay. Which virus is causing infectious mononucleosis and Burkitt lymphoma?
EBV.
Which of the following causes a zoonotic disease?
I think West Nile.
Yeah. What does zoonotic mean?
Zoonotic biannuals.
صح. West Nile, what does it, how is it like caused by?
Hold on. Wasn't cattle?
No, it's usually, I think, by mosquito, but I'm not sure. I think it is like by a vector مثل هيك يا يعني it's an insect, you know? I think. Wait, let me double check. بس أنا I remember إنه it causes, what does it cause? What's the most common thing that West Nile virus causes?
The West Nile virus, I think it causes syphilitis.
صح. Yeah, it is right. West Nile virus is spread by the bite of a mosquito. So, yeah. أصلا عشان هيك it's like it's a certain place, all of them cause exactly encephalitis. They have confusion, headaches because of the mosquito. طيب يلا. What is this?
This is acute,
And this?
latent,
Yeah. What
chronic,
is chronic? This?
late,
Yeah, or
or
slow.
slow, like prions.
Yep. طيب you have all the examples in mind. ما فيني أسأل. طيب, what's the primary goal of sterilization?
B.
We want to kill everything. Which of the following method is not considered a sterilization?
Washing.
صح. Which disinfectant is recommended in concentrations of 60 to 90% when mixed with water?
Quaternary ammonium. Oh, ethanol and isopropanol.
It's ethanol and isopropyl. لأنه quaternary ammonium is a very strong, not very strong, but it's stronger than ethanol and isopropanol. So
Wait,
we don't want,
isn't it the opposite? Ethanol and isopropanol are stronger.
but why would we want them to be in high concentrations if they're stronger?
بس الquaternary أنا عارفة إنه it's higher than isopropanol and ethanol in terms of
Higher as in like
لا
higher
لا 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 يعني
up.
quaternary is lower in terms of effectiveness يعني in terms of disinfection quaternary is lower.
صراحة I'm not sure, بس أنا اللي فهمته like أنا نفسي إنه ethanol and they're not يعني we need high concentration يعني okay نحن when we put them with water we're diluting them, right?
أيوة.
We're diluting them بس إنه with a concentration of 60 to 90%, so we still need a lot of amounts of them for them to be effective. But quaternary ammonium, I think we need less. Maybe it has to do with you know pH وما pH. It's probably that. It's not يمكن it's not strength. It's maybe because alkaline are more um I don't know, I'm not sure صراحة. We can look into it, but I have like تحت في an explanation why. We can check it together. So basically, quaternary ammonium, they're used at a lower concentrations because they're effective against a broad spectrum of bacteria, but not at the 60 to 90 concentration range. Also, basically, they're the most effective at a lower concentration. At high concentrations, they're not effective. That's what I understood. So I'm not sure. اسمعها افتي, okay? طيب, which of these is classified as a high-level disinfectant and sterilant?
Uh, high level disinfectant. I think hydrogen peroxide.
غشيتها من قبل شوي ولا؟
شو؟
غشيتها ولا you know this?
لا لا لا.
Okay.
I know this.
Okay, slay. طيب, glyceraldehyde is primarily used to disinfect which of the following?
Endoscope.
طيب, to prevent droplet infection, what are you advised to use?
Uh, wear regular mask.
طيب, ليش مو 95?
I guess N95 would be aerosol. I'm not sure.
N95 is for airborne infections. Droplet infection, a regular mask is able. لأنه airborne يعني airborne. Yeah. Anyways, اللي بالair تمام, it can easily go in through the regular mask. بس droplet خلاص it will absorb يعني the mask is going to protect you from a droplet. تمام. طيب, what are the three essential elements for an infection to occur? Oopsies.
Source, transmission, and susceptible. You need the source, you need the route of transmission, and you need a susceptible person.
Exactly. Which of the following precautions is recommended when you are performing surgical hand antisepsis?
B.
So you need to scrub for 2 to 5 minutes using an antimicrobial soap, and you guys learned this in pro. So as you said, three things are necessary for an infection. We need to have a source where there's the infectious agent. We need to have a way of transmission and a susceptible person. Well, this is the way that we learned in pro how to like wash our hands. But طبعا not, yeah, this is the way, but you can see how it goes all the way up to the forearm. This is more of like scrubbing because هم حكوا أصلا like surgical. So they do like the scrubbing. You're gonna learn this in fourth year when you do your surgery round. طيب, which of the following infection is commonly associated with needle stick injuries?
HIV.
طيب, well, give me another example.
HIV, what else? I guess probably EBV as well. I need to get
EBV, I'm not sure. I don't think so. لا. It's hepatitis B.
B.
Yeah. So those two are the most يعني هدول الأشياء اللي كتير الواحد بيخاف منهم. That's why you don't recap, you just throw. طيب, which device has the highest infection risk among...
Central venous. Oh,
Are you sure?
yeah, pacemaker.
Are you sure?
It's either C or B.
It's D.
Wait, D.
And I'll tell you why, because it's here. Basically, it's the one that has from 50 to 100. Because if you think of it, هلا, a cardiac pacemaker, you give the patient their pacemaker, وخلص, they have it for themselves. Okay? The central venous catheters, they're usually like impregnated with antimicrobials. You know, like how they're made with that. And basically لأنه they're used a lot, they try يعني there's a lot of rules for hygienic use. Cardiac assist device, you can think of it as it's more vulnerable because you're putting it literally inside the heart, تمام? And there's not a lot of devices that can help in cardiac assist. So you can think, it's like the devices are being used for, like the same device can be used for multiple people, But that's why. بس والله. Thank you so much for attending. Please guys scan this code, and if you have any questions, I'm more than happy to help. بس عن جد ياسر, thank you so much for attending.
Oh, come on.
Thank you for I hope يعني you benefited لو بس شوي يعني.
لا عادي, don't worry, I benefit especially لل pre-med أشياء وناسي